Good afternoon, everyone. Hopefully everybody's ready. I'm Quinton Lucas, Mayor of Kansas City, and wanted to announce a few changes to our order. As you all may remember, back on March 12th, it seems like some time ago, we issued our first order relating to COVID-19. Over that time since, we've had stay-at-home orders. We've seen some release of those orders, but we continue to make sure that everyone in the public knows that COVID-19 remains a significant challenge in our community. We have seen a dramatic number of case increases, particularly over recent days, not just in Kansas City, Missouri, but throughout the metro. And we're trying to take, I think, some steps today, some important steps today, to ensure that we're limiting the spread of COVID-19. In our 9th amended order, which is now available online at kcmo.gov, we announced the following. One, that we're removing the 50% occupancy limit, except for bars and taverns. And so we're removing the 50% occupancy limit except for bars and taverns. But somewhat more significant, we're requiring face coverings when indoors in all public accommodations. And so requiring face coverings in all public accommodations. What are public accommodations, you might ask? Most any venue that is not a private home, a private club, or some sort of private establishment where folks go in and out. So your grocery stores, any number of buildings, not unlike this one, will require you to have face coverings when you enter. Our order will go into effect on Monday, June 29, and will run for a period of 2 weeks, and at which time we'll evaluate once again to see if it's necessary. We've had many questions relating to the equity of orders like this one, and we are mindful of that. That's why Kansas City, and I've talked to Dr. Archer about it already, will, using funding that we've received relating to the CARES Act, be providing masks to those who will need them by placing them at community centers and partnering with social service agencies to ensure that we can provide masks to all those who may need them. We also continue to encourage all Kansas City businesses to make masks available to the extent they can, and will note that it is important for all businesses to comply. This is not a rule where we're looking to have, let's say, individual interactions, the police stopping an individual walking down the street. Instead, this will be complaint-based as relates to Kansas City businesses. There will be a few exemptions to the rule connecting to wearing masks indoors. One of those exemptions relates to minors, but we will note that there is strong guidance from the Centers for Disease Control and our own Kansas City Health Department that children over age 2 should wear face coverings, but minors will be a broadly exempted group under the order. We'll also note that people who have disabilities that prevent them from comfortably wearing or taking off face coverings, or that prevent them from communicating while wearing face coverings, or who have respiratory conditions, or who have been told by medical, legal, or behavioral health professionals not to wear face coverings will not need to do so. There's also a question as it relates to restaurants and taverns. Our direction is that all those who are not actively engaged in consuming food or drink, while adequately distanced, of course, should be wearing face coverings. So if you just sit at a bar all night, I guess, to watch everything, for whatever reason, then you should actually be wearing face coverings during that time. Again, I just wanted to take a moment before I turn it over to our healthcare professionals to note why we're taking this step. As we noted, Kansas City, Missouri has already had 3,236 confirmed cases. And sadly, at this point, 56 deaths. In our metro area, we're closer to 7,000 cases and 227 deaths. We've also seen that the Kansas City metropolitan area has broken records just this week, with 194 new cases on Wednesday. Our previous record was 193 new cases on June the 19th. We also see that in a number of other jurisdictions around our country, these rules have been applied, both in blue states, red, purple states, etc. And importantly for us, it isn't a political issue. Instead, it's an issue that's keeping people safe and hopefully saving lives. Washington, North Carolina, Nevada were the latest states to introduce mask requirements that went into effect this week. In Arizona, 28 counties, including Phoenix and Maricopa County, have added such an order. And in Florida, as many of you have likely seen, Miami, Fort Lauderdale, Tampa, St. Petersburg, and Orange County have all issued their own requirements. In Texas, and I think this is an important point for us, in Texas, we've seen their governor pause the reopening process and allowed certain counties to impose mask mandates. There are many who've asked us for months, and I see my friend David Alvey, the mayor and CEO of the Unified Government of Wyandotte County in Kansas City, Kansas, is here, and we probably get similar calls. And people have asked us for some time, how can you keep businesses open, or how can you reopen businesses? The simplest, sharpest, fastest way is by making sure that people wear masks. If you wear a mask, right, we're able to do a number of things. We have seen that there is great protection from wearing masks, and frankly, we see that it's something that's important in stopping the spread. I'll remind all of you of a case you all know well, which was from Springfield, Missouri, and the case of the salon worker, the beautician, who was exposed to COVID-19, was infected with COVID-19, but who saw an excess of roughly 100 persons. None of those persons fell ill. And we all believe a significant part of that, the reason that that did not occur, was because she wore a mask as instructed by public health guidance. As somebody who had the chance to talk to the mayor of Springfield after that incident occurred, I know he had great fear that there would be a high spike in infections. But because these mask wearing rules, the face covering rules were followed, they were able to keep people safe in Springfield. That's the same thing we're asking for today in Kansas City. Just briefly on the enforcement question, we'll note that citations can be written to businesses or organizations that fail to follow this requirement, and businesses are to refuse customers who do not wear masks, and the health department will largely be our agency that's working with compliance. In addition to making masks available at Kansas City community centers, we also would direct you to the site of kcppe.com. That's Kansas City Personal Protective Equipment.com, which is a resource for providing more information. With that, I have Dr. Erica Carney and Dr. Rex Archer, our Director of Public Health, with me. Dr. Carney is our Director of Emergency Medical Services. I believe Dr. Archer will have a few words, and then I'll likely come back and answer any questions for you. Dr. Archer? Do you wish to?
Yeah, I think.
So we'll actually go directly to Mayor Alvey, and he'll make real news for you.
Good afternoon. So today, wore my hat because again, the sun is out. It's coming through the clouds. I wear this hat to protect myself from skin cancer. It's a simple thing that I need to do. When I wear the hat, because I wear the hat, I do not rage against the sun for being the sun. I simply protect myself by wearing the hat. The same with the mask. I don't rage against the virus by wearing the mask. I simply protect myself and others by wearing the mask. Wearing the hat doesn't protect anyone else from skin cancer, but it may protect me. Wearing a mask can protect me from infection with COVID. It can protect others from infection with COVID. I wear a mask for others. I wear it for myself. I wear it for my family members. I wear it for my friends. I wear it for my colleagues. I wear it for the citizens of Wyandotte County. We want to continue to reopen Wyandotte County. Our best opportunity to continue to relax restrictions is for us to take necessary, simple measures like wearing a mask, washing hands, maintaining social distancing, avoiding large gatherings. If we do those simple things, we can continue to get back to business. However, based upon the trends that we are seeing in Wyandotte County and across the nation, if we don't continue to stop the virus will stop us. It's as simple as that. Let's get over the political divisions over the coronavirus. It is what it is. Pay attention to it, see what it is, where it seeks to go, and let's do what we can to stop it. I wear the hat to protect myself from skin cancer. I wear a mask to protect myself and others from COVID. Thank you.
Following those two is quite an act, and I just want to re-emphasize that we are learning about this virus, and that close to 50% of the people that get the virus don't show symptoms or don't realize that their symptoms, because they may have allergies or other things, are due to COVID. What that means is that you're wearing a mask as a courtesy and showing our community love to others, to protect others. The high-risk folks that if they get this disease can end up in the hospital or worse. So that's why we're asking everybody to do this. I do want to emphasize for those children that are younger, there's a risk of suffocation, so we don't have masks on them. Most of you that have dealt with 3, 4, 5-year-olds, sometimes it's hard enough to keep their shoes and socks on, let alone a mask. So we're not wanting anybody to be denied service into a grocery store or whatever where the adult is masked and the toddlers aren't. But what we've seen across the country now is just here in June, from the first week of June and compare it to the third week of June, those states that require masks for both the employees and the customers have had a 12% reduction in cases. Those states that only require it for the employers have had a 70% increase. Those that don't have any requirement have had an 84% increase. So that's why we want to do this, because we don't want people being evicted because their business was closed. We want to be able to open the businesses, but we want to do it in the safest possible way. So the guidelines are very clear. We can protect each other with this. And the issue really is, I can't infect you if I've got a mask on, and you can't infect me if you've got a mask on. So thank you. Dr. Carney?
As a current healthcare worker here in Kansas City, an emergency medicine physician and an EMS physician, I just want to sincerely thank our mayor and the other mayors for their messages on this. I would also like to thank the current healthcare workers who have been at this for over 100 days now with nonstop meetings, budget cuts, and everything else. But despite this, every hospital here in town continues to meet every week. Every hospital still requires every visitor to wear a mask, every patient to wear a mask. And they also continue to have visitor restrictions as well. All of the hospitals will continue to meet as long as this continues, and this will also include our EMS agencies and fire departments under the direction of these two guys. So thank you guys for that.
Thank you, Mayor. Thank you, doctors. I'm Alan Greiner with the Unified Government Wyandotte County. I'm the health officer there. We're just here today in support of this new ordinance. We're developing our own ordinance in Wyandotte County, Kansas City, Kansas right now, and we'll have more information on that probably within the hour. We've been in close contact with Dr. Archer over the last several days, and we're seeing the same evidence he is. We're seeing dramatically increased cases. We're seeing dramatically increased numbers of individuals seeking testing. The positivity rate of the testing is going up on the Kansas side of the state line in the last 2 weeks, which is extremely concerning to us. So we think mask ordinances and cooperation by our citizens can make a big difference in curbing this coronavirus and hopefully preventing us from having to step back further. I want to reiterate that this is about working together. I think we're doing that. That's why we're here in KCMO right now. I think we all need to do that as a larger metro community, and we hope to have others joining us in the coming days in these efforts. Thank you.
All right. Thank you all, and thank you, Mayor Alvey, Dr. Greiner, for coming from Wyandotte County, Kansas City, Kansas today. I think this does show, and as Mayor Alvey put so well, this isn't about geographic boundaries or politics or anything under the sun. We're taking these actions to try to keep people safe. With that, I'm happy to take any questions. We'll go in the usual line, and so go right ahead.
Okay, so you spoke about this a little bit yesterday at your press conference, but Kansas City, Missouri can have its own mask requirements, but then when you go over to Johnson County and it doesn't have it,
Sure.
are you worried about that,
Sure.
that spread between counties that people flow through so easily?
So let me say this first. Our health professionals are actually the guide in cooperation. I know they talk frequently. I know they're all working together to make sure that we can see consistency. And what I would say is this, and hopefully I don't speak out of turn, but every health professional I've talked to has said masks are a good idea. And so whether it's mandatory where you live or not, right, and whether you border Kansas City, Missouri, you're watching 3 hours from here, I think from what Dr. Archer has told me, a mask is a good idea. What our state health director has said, a mask is a good idea. And so we can talk about what rules or technical rules or anything under the sun, but this is in some way different than those stay-at-home orders and the businesses opening and all of that, because this isn't shutting down a single business. This isn't stopping any type of commerce. This is just saying, how can you stop the spread from impacting others? And so that's why actually I guess my concerns are a little bit allayed by the fact that really just wear a mask. And we're making this rule today in Kansas City because we think it's important to make clear to the public how important it is. And we've had a number of business owners that have called my office or Dr. Archer's office and said, we actually need some sort of rule. It makes it easier for us to tell customers, yeah, a mask is required because the city requires one. And we just think that's an important step for us today. Is there any other questions? Yes, ma'am.
You said that this will be enforced by individual businesses not allowing people not wearing masks into their place of business. What happens if the business refuses?
So we'll go through the usual process, and the question relates to how does enforcement work? As we noted some time ago, our police department does not enforce these orders. We largely have the Kansas City Health Department handle enforcement. It is typically a complaint-based system. And so there are people that call my office and Dr. Archer's all the time. The idea is if you have a concern with a business that you have been to, you can call 311 and you can report the fact that, and we get this from a lot of employees, waiters and waitresses, who have said that nobody we work with are wearing face coverings and that sort of thing, and they feel in some way at risk. You can call us. The health department is actually very friendly with this. We're not trying to be Big Brother. We usually will send a follow-up letter. We'll then from there usually try to make some sort of contact with the business to get them to comply. I think regardless of your health department, it's not unlike our restaurant regulation realm where we try to see if there's good compliance, and only after that and only after a number of steps do we address more issues relating to any types of fines or necessary business closure, which would be the high end of the rules. I do think it's important to note this because a lot of people will ask and talk about their individual freedoms. Right? There's a reason we're making a business focus on this or an institutional focus on this. We don't want anybody stopped on the street or an individual who has some concern to face some sort of penalties from it. But we do want to make sure people comply. And we think a good way to make sure that happens and that we stop that spread is when you're going to that crowded grocery store, just have a mask on. When you're interacting in those crowded environments, having a mask on. And this is just a rule for the indoors in Kansas City. So it seems as if there are lots of opportunities for you beyond that. But those are really the guidelines for what enforcement looks like for us. Yes, sir.
Talk about businesses lifting the 50% restriction. I would imagine a lot of owners would be elated with that stuff. And by providing these masks or requiring them, we could see that we never go back down if we're requiring the business standard. That's a first sell it to the business owners. And second, are you disappointed other places didn't require them? It sounds like Wyandotte County is requiring them, like what about Jackson and Clay and Johnson?
I'll take the second question first. Look, I think everyone that I have heard and every medical and health professional that I've talked to says that masks are a good idea for their communities. And so I think hopefully this action today, Mayor Alvey talking, Dr. Greiner talking, so many others, really just helps solidify that fact. And I'm elected to be the mayor of Kansas City, Missouri. And so we'll try to do what's right for this jurisdiction. We certainly will communicate with others in all types of situations, but it's not my call necessarily to say what others will do. I can have my own opinions, but more than anything, I hope people just wear masks. And whoever's watching just puts on a mask when they're going into some sort of environment where it'll be necessary, any situation of public accommodations. I'll also say this about the Kansas City order that was issued today. There will be some who try to bring up any number of reasons why there shouldn't be orders like this. I believe we thought of that, right? Following public accommodations language, which is the same thing we do for every other federal law or anything like that, doesn't infringe on private businesses, private residences, any of those types of activities. What we're saying though is if you're coming out in the public and you're going to be in a public space, in a public building, you should wear a mask. Frankly, if you're outside next and close to someone, a mask is really something we recommend. And so no, I don't have that concern. You'll have to remind me of the first question.
Businesses, it's going to have a good financial impact on the bottom line of a lot of business owners by dropping the 50% cap. Now they can go back to 100% independently residential.
So yeah, in terms of business owners and the capacity rules, the idea is just going to be very simply this. We would really prefer if everybody was actually following our good distancing rules and everybody actually had a mask on. We're not as concerned with the numbers generally. We always want to be cautious, but I think what we're trying to say in this order, and certainly my conversations with our health department have been, we want people wearing masks, we want people washing hands, we want people really taking those steps that are ensuring that we're stopping and halting the spread. And that's where our focus is going to be. That's where the Kansas City's enforcement focus is going to be. Frankly, that's the sort of work we're going to be doing and trying to provide masks to anyone in Kansas City who needs them. If you go to any number of public facilities already in Kansas City, you'll see that sort of thing. And so that's where we'll be going. Yes, ma'am?
Talking about Westport, a lot of people congregate right outside the bus and don't actually step into it. Does this guidance provide any guidance to those patrons that might be congregating outside where it can be
And go ready, Morgan.
So like businesses in Westport, should people congregate
Yeah, I thought so.
outside?
Right.
Does this affect them at all?
So bars and taverns are, so in terms of capacity rules and that sort of thing, bars and taverns are still under a percentage capacity rule. And so they still have that same set of rules. Restaurants will still be required to have distancing. So we would still encourage that. I have seen the same photos you've seen in connection with these large crowds in Westport and other places. We would encourage people to maintain social distancing and to actually make sure they have their adequate mask wearing rules. So yes, we do think this level of good advice applies to all of them. And by the way, I'll make sure for our Wyandotte County friends that Mayor Alvey will come up after to answer questions if you have any for him as well.
I
Shannon?
have a question for Dr. Archer.
All right. I will make this my last one, Dr. Archer, then we'll follow with the Wyandotte County crew.
So, Dr. Archer, I understand on that call yesterday, 5 of the 7 directors of health that were on that are not in favor of a mandate for masks, and there was just 2, Wyandotte County and KCMO, that were. Can you kind of tell us why there's such a dichotomy there and how this is going to affect Kansas City and other parts of the metro?
So I'm not sure that's the perfect characterization of that call. The science on this has been coming out fairly rapidly in the last month. Some of this still isn't even published. Some of us have had access to unpublished data, which has helped us in making our recommendations. I would say that most of the health directors, well, we all agreed that we were going to put out a statement in the next couple of days supporting the wearing of masks and that it's the right thing for everybody to do. Anybody that is wise talks to their elected officials before they make a commitment on a mandate. And so several of them hadn't had the chance to go back and talk with their elected officials yet. So give it a little bit of time. I mean, that's part of us being in an urban core, and we have our issues and concerns, and we're going to move forward. My guess is a lot more will find this as the best way to keep their businesses open also. So, I think the issue is talking about a mandate when they hadn't even talked to their elected officials about this yet.
Of the conversations you've had with them, how many do you think are going to commit to some sort of a mandate? I know Johnson County right now is absolutely not going to do it. But how many of the 7 counties in the metro do you think will end up with this kind of an order from your conversations?
Well, I bought a crystal ball yesterday.
From your conversations.
So, as the science continues to grow, as the evidence is clear that the states that are opening up that have these mandates are having better public compliance than the states that aren't, and that they're getting into trouble, they're now having to potentially triage hospital beds and other things. Inevitably, this is going to be every place. If we had the right OSHA at the national level, this would have already been mandated for all employees, period, anyway. And we don't have that, unfortunately. And so I think the issue is, don't get hung up over the mandate. If there was no legal system in this country to require anything, we should be doing this because we care about each other. This isn't an issue of mandates. Now, what I have found is, whether it was with non-smoking laws or other things, once you pass the law, it sends a clear signal to the public that the science is there, this is important, and people then start peer pressuring each other. So now once the law's there, then folks will complain. They'll raise issues. The mayor talked about enforcement. So we get a complaint with 311. We then call that owner. We talk with them. If we get a sense that they're going to correct the problem there, that's it. If we get another complaint or we get a sense they're not going to correct the problem, then we send a certified letter. If we don't get compliance, we do a visit. And if we don't get compliance there, we give them a mitigation order, and if they don't do that, we take their occupancy away. So we will move through this and protect people, but we're going to give businesses time to adjust. Nobody should be refusing the first day of this ordinance for people to come in who don't have masks yet, and the business hasn't had a chance to order the masks and be able to provide them free to customers or a low cost. I mean, but we want to make this clear that this is where we need to go. Don't delay. We're going to start ordering extra masks, as the mayor mentioned. This is the change that will help our economy. It'll save lives. We're in the second wave in Kansas City. As you know, we shut down before we had our first case, luckily, that we knew of. We had 16 deaths in the first wave. We've already got 16 deaths in the second wave. We've got to do this to save lives and save our businesses.
Mayor Rowley, if you have any.
Come your way.
Thank you. Any questions? I'd be happy.
Can you provide any details on what the guidance you said would be coming later today from your office will look like?
Dr. Greiner?
Thanks, Mayor. Our guidance will be similar to the guidance you've just heard about. We're also looking closely at other states in the United States that have guidance, especially Washington State, which has an ordinance that's going into effect, I believe, at 5 p.m. Pacific time. So there will be similar exclusions to the ordinances, just as you heard about from Mayor Lucas. But we hope to have all those details, like I said, literally within an hour, so that that's widely available on ycokck.org.
Okay, thank you.
All right. I assume that's good for you? All right. Thank you all, and we'll come back in 2 weeks to discuss either extension of this order or our next phase. Thank you.